Today we had to give surgery to a very difficult and, from a medical point of view, interesting but very challenging case. This patient had received, because of a prostate tumor, 2 rounds of radiotherapy. Then, since the tumor was invading the bladder, he had received a cystectomy with a reconstruction of the bladder. We call it orthotopic reconstruction of the bladder. That means the patient is urinating through the urethra, but the bladder is gone. The prostate has been removed. But unfortunately, many years later, 10 years later, he is still developing an increase of the PSA, and the PET scan demonstrated a single node, lymph node, behind the sacrum bone near the rectum. Very difficult thing to do. Very difficult to give a 3rd round of radiotherapy of the same patient. So we decided for cryo. Cryo is an ablation therapy, a minimally invasive therapy. You put a needle inside the tumor, you circulate a special gas inside the needle, you generate ice at minus 185 degrees, you involve with ice the whole dimension of the tumor, in this case a lymph node metastasis, and you destroy it. Of course, decision of the access is very important, because you have to put the needle through the skin in local anesthesia inside a CT scan, looking what you are doing in real time, while you have to be careful of the nerves, of the blood vessels, of the rectum, of all the sensitive areas that you don't want to touch. So this is exactly what we did. This patient has received a cryoablation with 1 single needle placed under local anesthesia of a pararectal lymph node. There are many possibilities to treat in such a way lymph nodes, not only near the rectum but also in other parts of the body. It is interesting to note how we can treat these patients of these lymph nodes. Can be placed, these lymph nodes, not only near the rectum, can be also near the major vessels, sometimes in between aorta and cava. So wherever the lymph node is placed, we can treat it, sticking a needle inside. The patient can come the morning, receive the surgery, and go home the same day, which is very interesting because we can do it in local anesthesia, really minimally invasive, on an outpatient basis.